Borough President Donovan Richards, thank you for convening this very important press conference. I'm going to speak as loud as I can because there are some community members passing by that are saying that they can't hear us. So I'm going to try to speak as loud as I can. So my name is Aminta Kilawan Narine. I'm the founder and executive director of South Queens Women's March, and I've been a resident of South Ozone Park for the last 30 years and a community organizer in this area for the last 10 years. People are asking, why are the rates so alarmingly high in these neighborhoods of Richmond Hill, South Ozone Park, and Ozone Park? How did this happen? Now, I want to say a little bit about our community and who we are. We are comprised of many people of all different walks of life, and here where we stand is the intersection of many Indo-Caribbeans and Punjabis just neighboring us on 101 Avenue. We're a hard-working people. Many of us are working class, many of us are blue-collar workers who have no choice throughout this pandemic but to go to work. We're the people that couldn't afford to stay home. We're the home health aides, the healthcare workers, the food service workers, the grocery workers, the MTA workers who run the buses and the trains. We're the taxi drivers whose space we're occupying right now, actually. And what that means is that every day our community members are literally putting their lives at risk to help run this city. What that means is that we need more resources in this community. I'm grateful that down the block right here we have a testing site. That's incredible. And if you come to this neighborhood, you know every day there is a line at that testing site. Our people want to do right by themselves. They want to get tested, and they are getting tested. And I can assure you that we need more resources at every level of government, at the federal level, at the state level, at the city level, for us to truly overcome and recover from this pervasive virus. That also includes as many vaccination sites as possible. As was mentioned before, we can't afford to go to Manhattan to get our vaccines. We need vaccines here in this neighborhood. Our people can't be taking buses upon trains to get a vaccine. Our people can't be waiting on long lists of lines to access vaccines. Just as we were standing here, there was a community member who asked folks here, how can I get a vaccine? I want to get a vaccine. I don't have the internet. I don't know how to access a vaccine. And these are questions as community leaders we have to grapple with too. How do we advise our community members that are asking us day in and day out how they can get the vaccine here in their communities? I also want to highlight one other thing that most of us know is true. In our community, what the numbers of the coronavirus are showing us is just how many of us exist in this community. Census numbers and statistics don't actually reflect how many of us are here. And we know we exist, we know how many of us are here. So many of us are undocumented and living in the shadows, but we are getting tested and we are trying to do better by ourselves. So I'm just urging everyone here today, and I'm grateful for our partners in government, I'm urging us to keep on fighting. I'm going to say, what do we need? I'm going to say vaccine. So I'm going to say, what do we need? And you're going to say vaccine. What do we need?
Vaccine.
What do we need?
Vaccine.
What do we need?
Vaccine.
Our next one here from CB9. Ken. Cheers. I'm learning everything. Cheers. CB9.